We are live. Today we are talking from prescription to prediction, how AI is modifying patient care in pharmacy. So welcome to this show. Welcome to AI for pharmacists. So guys, we have been running this for a while now, teaching how we can use AI to improve our pharmacy practice. And tonight we are having this special session where we talk about AI in pharmacy practice, not just prescription, but now we are going to the level of prediction. How can AI help you to move from just prescription to prediction? That is what we are going to discuss in today's session. Are you ready? Are you ready? Are you ready? Are you ready? Okay. From prescription to predictions, how AI is transforming patient care. Our primary goal as pharmacists is to ensure that we offer our patients the best of care. It takes a lot of time, it takes a lot of effort, but here we are. Here we are, ensuring that we are doing the best that we can using AI. So no need time wasting anymore, no need having challenges with creating content or anything with AI. Here we are going on lane 8, right? Okay. So we say if you are here, let us know where you are joining us from. Let's know where you are joining us from. Where are you joining us from? Let's hear you. Okay. We'll get started. We are already started even actually. I'm already sharing one or two things. Unlike last week that I canceled it, it doesn't matter. I'll go on with this one and teach the full course as it were. Okay. Those who want to take advantage of AI in their practice as pharmacists should do that. Okay. It's my pleasure to have you online. If you know any other person that's supposed to be here that's not here, let them join us. From prescription to prediction. That is how AI is changing practice of pharmacy. And in the AI-powered pharmacist bootcamp, many people are making a lot of progress with AI in their pharmacy practice. We are actually going into phase 5 in that program. We did phase 1 where we talked about introduction, get people familiar with using AI tools. We went into phase 2 where we use AI for practice. We went into phase 3 where we use AI to build personal brands. In phase 4 now, we are talking about how to monetize your expertise. In phase 5, we'll go to those in community practice and how you use AI in your community practice. This is an interesting time we are in. For those who are taking advantage of AI, it will make a difference in their practice. And we're already seeing it, okay? We're already seeing it. So, Famfumi Oluwade, welcome. Nice to have you from Abeokuta. Okay. It's my pleasure that you are here with us. Okay, today we are just going to go full-fledged. It doesn't matter how many people are here, others can watch it later. I cannot help it, but just come out here and teach pharmacists how to use AI in their practice. I'm happy that you're here. So let's go on. Let's make into presentation. We don't need to waste a lot of time. Okay, so let me share my screen. I will share my entire screen. Pick it up. And here we go. All right, so let me change the settings to this. I prefer to use this. All right, so let me remove this banner. Let me hide this banner. Okay, now let me share the full screen. I believe you're seeing it already. Okay. Where are we? Good. This is where we're supposed to start from. So welcome, welcome, welcome. Okay, let me also check what's happening here. That we are doing. Okay. All right. So here we are. From prescriptions to predictions, how AI is transforming patient care. And in this, we are going to unlock the future of pharmacy and healthcare with AI. This session may be for like an hour so that we can all retire to where we are. But most importantly, you are going to gain a lot of value from today's session. So let's get started. For those who are just for the first time of joining this, my name is Gabriel Gambo Mmadu. I am a pharmacist like you. I actually still practice pharmacy. In addition to that, I am a management consultant. In addition to that, I'm a supply chain practitioner. But in the context that I'm talking to you now, I am an AI consultant, an AI educator. I'm the founder of AI Mastery Academy. I'm also the founder of Health Tech Innovation. So for now, AI Mastery Academy is operating under Health Tech Innovations. And what we are here for, Health Tech, is empowering pharmacists, healthcare practitioners, doctors, nurses, and all of them with that skill, digital and tech skill, that they can use in their practice and to deliver value. Whereas AI Mastery Academy is helping people, business owners, entrepreneurs, professionals, harness the power of AI in their life, in their work, and in their business. That is what I stand for. And we created AI Mastery Academy to meet a gap that we found in the market. People have been hearing about AI, but don't know how to use AI. People have been hearing about AI, but don't know how to maximize the power of AI. So we created AI Mastery Academy to bridge the gap, to bridge that gap so that people will get the best of AI in whatever area they want to use it. And that's how, when we launched, and we have been running AI Mastery Academy, a 30 days program, back to back. We have had 5 cohorts. Another cohort starts on September 8th. And we also ran a program called AI-powered pharmacist bootcamp. We have the first cohort. They're about finishing by end of this week or end of next week. And the new cohort also starts on September 8th. I want you to be part of it. I want you to join it because it's doing a lot of wonders to pharmacists like you. You don't want to stay behind, okay? Now, let's go into today's show, from prescriptions to prediction, how AI is transforming patient care. And this way, we are going to unlock the future of pharmacy and healthcare using AI. So there's a new era in patient care. Let me ask you a question. Have you used AI in your pharmacy practice before? Tell me, have you used AI in your pharmacy practice before? Let me see in the comment. You can say it in the comment. Have you used AI in your pharmacy practice before? Or in any way at all, even if you don't the pharmacy practice, have you used AI in any way before? If you have, let us hear it. Okay, like I mentioned earlier, participants in the AI Mastery AI-powered pharmacist bootcamp are already using AI in their pharmacy, and sooner or later you begin to see them doing wonders online using the power of AI. So what is happening? What is happening in patient care today? There's a shift from prescription to prediction. It's not just a matter of reactive treatment. It's now proactive prevention. With AI, you can determine what the outcome of a person is in practice. So you want to give a drug to a patient, for example, you can predict the outcome based on the information you have about that person. Excuse me. Okay, so you want to give, we know that drugs have side effects. We know that some people react to drug in different manners. We know that the outcome that people get, the result people get with drug differ based on particular condition. Now, by just gathering information about the patient and putting it into AI tool and telling the patient, the AI tool, this is what I want to give, you can predict if this person is going to have an issue, if they're going to have a compliance issue, and so on and so forth. So instead of being reactive with AI now, you can be proactive. You can nip something in the bud before it happens. You can say this is likely to happen and find a way of overcoming it. That is the shift that's happening. Now, we are using AI transformative power to revolutionize patient care across board. In every stage of meeting your patient, you can use AI to improve service. Okay? You can use AI to improve service. You can use AI to improve patient adherence. You can use AI to check for drug interaction or contraindications and everything and ensure that your patient get the best of his drug use. So from Abdul Fatai Akinloye says, yes, I've been using AI to review my patient drug therapy for assessing potential DTPs. Good. I like that. So you see, this is evidence that AI is a tool for pharmacy practice. Are you using it? Fatai has said, yes, he does. Now, with AI, the opportunities for pharmacists is now widened. You're not just limited to the regular traditional pharmacy practice that you know. Now you can create a new role for yourself as a pharmacist. You can go into, you can even create your own wearables. You can create your own apps. You can create your own tools just using AI and the power of AI. You can go into a new set of practice. So in our AI-powered pharmacist bootcamp, we are helping people uncover new areas of practice. We are helping them uncover new areas of practice. It is not just a matter of, okay, I want to use AI in my current practice. Of course, that is part of what we are talking about, using your current practice. But it gives you another opportunity to create something else, something that you may not have even thought about before. With AI, you can go into new practice and excel in those practices. Okay? Then, of course, AI is giving us practical tools that can give tangible results in healthcare professional. It saves you time. It makes you have better quality. It helps you grow your business. I was recording one of the videos this morning, and one of the things I'm recording is how to structure your pharmacy, your community pharmacy. So many of us have community pharmacy and we are doing trial by error. Okay, there are things that we need to put in a pharmacy, but we don't even have budget for them. Some of them we don't even know that we need to have them. For example, SOPs. I can bet you that more than 90% of pharmacists in Nigeria do not have any SOPs. And these are things that will make your pharmacy stand out. I was teaching in that video how people can come to your pharmacy and they will still get the same service irrespective of who is there. But for a lot of times, there are patients that will come to your pharmacy, and when a particular person is not there, they go back. You can lose business. However, when you have SOP set up in your business, you can ensure that there's a consistency. You save time. You do things in such a way that it can be repeated and repeated and repeated. Okay. Another thing is when you have staff turnover. So a staff leaves your organization and you employ a new staff, and this new staff doesn't even know what to do. When you can structure your business, you can get anybody into your pharmacy and continues at the rate in which your pharmacy is going. That's one of the things that we're teaching in AI-powered pharmacy. So you see, empowering our pharmacy business itself, as it were. Okay. Now, how do you do that? How do you ensure that all these benefits come to you? You have to get started. AI can help you create a clear roadmap to integrate AI into your practice. We taught how to use AI in pharmacy practice in phase 2, and we're teaching how to use it to build personal brand and even monetize our knowledge of pharmacy. That is the roadmap that AI can create for you. So you can come on AI and say, this is what I want to achieve. Give me guidance. Depending on the tool you're using, in this video this morning, I used Study and Learn. And I brought it out, and you can see how you can use AI to even learn a lot of things and decide a pathway for yourself. So AI is not that strange tool. AI is not that thing that is the way. AI is something that will make a difference in your practice. So let's go back to what we are doing right now. What is the current reality? What are the challenges that we are facing in patient care? I'm sure without even me mentioning it, you can by now bring up a lot of things that you face in practice. And I want to assure you that whatever it is that you face in practice today can be overcome using AI. So pharmacy and healthcare professionals face increased pressure. Yeah, increased pressure. You are not even able to cater to your target, your clients or your patient as much as you want to do. Okay, patient load is increasing day by day, and the time that you have is limited. Patient load is increasing and the time is limited, especially that we have even limited number of personnel. So imagine in a teaching hospital, most teaching hospital that I know barely have 30 to 40 pharmacists. Barely have 30 to 40 pharmacists. But let's see the patient. What is the ratio of one pharmacist to patient? So too much. So you are not even able to give the pharmaceutical care you want to give. You are not able to do follow-up. You are just able to give minimal information to your patient. Okay? What if you are able to find a way of using AI to follow up on those patients that you are not able to attend to during your shift? Do you know that is possible using AI? You can now use it to improve patient adherence. Okay? How about the challenge with medication error? Now, because you're attending to a lot of people, you have a chance of making mistakes. You have a chance of, it's possible to miss out on interactions. It's possible to miss out on contraindications because you are hurrying to attend to this patient so that the workload that you have, you can let it go. How about adherence? Sometimes you're not even able to advise your patient enough to know what to do to adhere to the medication prescription that was given. What if you can use AI to make this difference? Okay? So these are the things that AI brings and gets to improve in your practice. There's even a demand now for personalized healthcare experience. We have what is called precision medicine. Precision medicine is you look at an individual and you create a treatment pattern for that individual. You are not looking at, okay, this drug is for everybody. You are looking at this person, his problem, and you design a drug or a therapy for this particular patient. So you are not even looking at general management. You are looking at the management for this precise or this particular patient. Personalized. AI can help you achieve that. So these challenges that we have, like medication error affecting over millions of people annually, which could lead to adverse events and healthcare costs, can be reduced using AI. So these are the challenges that people are facing now. How does AI come in? What is the paradigm shift that we're going to experience when you begin to use AI? First, prescriptions. Traditionally, healthcare has been reactive. You treat illness as they occur. You treat illness as they occur. Okay? Of course, we have what is called prevention. Prevention is education. You tell people, don't do this, don't do that, don't do that. But with AI, you can predict. You can prevent illnesses before they manifest. You can gather data about a person and know when it's likely the person will start having a particular kind of symptom, and you can nib it in the bud. So you can create a personalized pathway for prevention. Not necessarily saying, if you have family history of diabetes, avoid this one. If you have family history of hypertension, avoid this one. If you have a family history of Alzheimer's, avoid this one. No. Now you are looking at that particular person and coming up with a plan that will help the person. Okay? So what does AI do? AI harnesses vast database, data set, identifies intricate trends, and analyze patient history and anticipate what are the future health needs. We know in general that if a person has a family history of diabetes, the chance of getting diabetes is higher than 80%. Good. We know that if they do not do lifestyle modification, this is imminent in their life. But how about being able to use the data available and the history of that patient and say, you, in the next 3 to 6 months, this is what you are going to experience. In the next 3 years, this is what you are going to experience. Then you can come up with a personalized plan for this particular patient. Okay? So, again, in another way, AI can predict potential drug interactions. It can identify patients at high risk of non-adherence. Okay, non-adherence is a behavioral or attitudinal matter, right? So a person can take a drug and say yes and goes away. You don't know whether it's going to adhere or not. Now we say with AI, it can predict a person who has high risk of non-adherence, and even foresee adverse drug reaction before they even happen because of the information available. This is how far AI has gone in patient care. All right. So how is it transforming patient care now? The first part of it is drug discovery and development itself. So AI is helping in accelerating research and development cycle, bringing new treatments to patients faster. It takes years of testing and testing and testing to come up with drugs. And there are so many candidates that your company will have spent a whole lot of money, and many of them will fail. Only a few will succeed. Today with AI, you don't have to spend all that money. You use AI to do all the prediction, all the design, and even say what is likely going to be the side effect pattern of this commodity, of this product, the chances of it solving the problem, everything, right before you even create the drug at the design level. So drug discovery and development is now faster and even cheaper, because all those money people companies spend on discovery and testing are removed because AI, using data set available to it, has reduced the pattern. So we can get drugs out as quickly as possible. Okay? Because of the data available. Then personalized medicine, like I mentioned earlier, is also what is now reigning. Okay? Personalized medicine. And for those of you who are interested in clinical practice and want to create maybe further and get more degrees in your practice, I would suggest you look at personalized medicine or translational medicine. These are areas that are picking up now because the need of people now is not the general kind of need. People are looking for bespoke treatment that are tailored to their own particular profile so that they have maximal efficacy. And with AI, you can create this. With AI, you can create this. How about medication adherence? How does AI help in that area? You can implement smart reminder and sophisticated patient monitoring to improve compliance. There are AI tools, even that you can install on WhatsApp, okay, and could give people reminder about taking their drugs, reminder about maybe meals, reminder about exercise, remember that about several different things that they need to do to improve their health. Many times patients forget to take their drugs. Many times patients are not even keen on doing it, but this technology takes them to the level where they want to do all those things to get the result that they desire. AI tools are at work to create that for you. We even have wearables. In actual fact, there are even tools that have been created that can be administering some of these medications on their own. And I'm sure you know that those tools work on AI technology. And this takes us to the fact that many people think that AI just came a few days ago. No, AI has always been there since the 50s. So AI has been imbibed in some of these tools, some of these wearables, and they are achieving goals for patients. How about predictive analytics? AI can proactively identify patients at high risk of developing certain conditions or complications based on available data and those people's history. So, and unfortunately, in this our climate, we don't even have continuous information. You can go to a hospital and some patients have more than 5 folders. The last time they came, they forgot their card, so they have to open a new one. They are not able to trace the old one. All the history in the previous one is gone. Thank God for hospitals now that are implementing electronic medical record or electronic health record, With those ones now, you can consistently follow up. But what if those patients now go to another hospital that does not have link with this old hospital that they are using? That information is lost. I know with time, we're going to have a database that connects everybody wherever they are. But at least in the hospital, there's electronic health records now that's working, and many people are taking advantage of that. So with that data available about this patient, you can do predictive analysis, analytics, and get to know whether this patient is at stand the risk of having a particular disease. And even you can use AI to even recommend medicines that you need to give for certain conditions based on what has come up from that analysis that was done. So AI also helps you support your clinical decision, providing rapid evidence-based insight to support healthcare professionals in critical decisions. There are some conditions that you might see with your patient. You may never have experienced it before, or you're not too sure of how to go about it. Instead of doing trial by error, you can employ AI and say, okay, this is the condition. What do you think? How can we put this and this together to get the result we want to get? So you see AI. AI is here to assist you. For those of you who are afraid that AI is here to replace you, I tell you, AI is not here to replace you. AI is here to assist you and to help you get result as a pharmacist. Okay, so let's look at real life applications in pharmacy, how AI is being applied in pharmacy. Chatbots. So chatbots are created in such a way that as you converse with them, they return. ChatGPT is a chatbot, for those who don't know. Gemini, Claude, DeepSeek, all of them are chatbot. You send a message, it gives you a response. You send a message, it gives you a response without anybody on the other side responding to you. Now, there are other tools which have been created who even are more automated than ChatGPT and the rest. Now, not that they are giving better results, but many of them are built on top of ChatGPT. So, for example, it happens, people use it on Instagram, people use it on I'm sure sometimes you have sent a message to a DM. You have sent a DM on Instagram, on Twitter, or on Facebook, and you get message. You get response immediately, and after some time, you get another response as if somebody is sitting and responding to you based on the action you are expected to take. That is chatbot. So what you can do, you can create a chatbot that your patient can interact with. After just one interaction and giving information, all right, this chatbot is activated, is triggered, such that it can begin to send message at regular intervals or when it is due to send the message. Okay, when it is due to send message. So this chatbot can also give counseling. For those of you who are using UBA has a chatbot called Leo. You can ask questions about Leo, you can ask for advice, you can ask for opinion, and it will give you. That is chatbot working. So what do you do with chatbot in pharmacy? You have already given it a database, a lot of information, and your patient can come and ask questions, and they get answers. Now, you can also create it for your business. So your pharmacy, people can come and ask questions about it on your pharmacy website, for example, or on your WhatsApp, for example, and they begin to give response. And you're not there. You're not the one responding. That is chatbot. And many people are using it in the pharmacy, especially the big pharmacies. Okay? All right. Now, we can also forecast needs. So you run a pharmacy, you have inventory, you have different commodities, you have them there. You can employ AI to optimize your inventory, predicting the demand for specific medicines based on trend. It can tell you, okay, based on history, we are approaching October, November, December, flu may increase because Harmattan is coming, do this and do this and do that. It can even give you advice on how to ensure that you are able to attract the right customers and sell off these commodities. It can tell you that this commodity, this is the rate at which it goes. If you need to buy, this is the quantity you should buy. And what does that help you? You are able to stock the right product and not have overstock or understock. or out of stock. Now, many times you go to some pharmacy and there are some commodities that were purchased in large quantity and have been there for months and they have not been sold. Okay? Meanwhile, there are some that are fast moving, money is tied down somewhere, you are not able to buy enough quantity. But with AI helping you in predictive inventory management, it will tell you and say, okay, this is what you have done in the last so and so time. This is what you are likely to do. So, we're now looking at the consumption data. We're looking at even the service data, even all the data available. You can do quantification and forecasting for you and tell you this is what you need to do. Whether you're in the hospital pharmacy or you are using a community pharmacy, this works for you. If you're in manufacturing, it can also help you with your inventory management. How about drug information? You can instantly get access to vast amount of drug data for precise answers. So you are not guessing your answers. You are giving answers that is precise and correct. In the AI-powered pharmacist bootcamp, we practicalize this, how you can get information about drug-drug interaction, and you can even draw a management pattern for a particular patient, maybe diabetes, asthma, or anything like that. You see, drug information that you need, and how you even need to do patient education to enlighten them about drugs or medicine that they are taking or disease condition they have. AI can help you with that one. How about telepharmacy? Telepharmacy is still infancy in our climb here, but it's an opportunity for you to help your patient to get the best result in their management. With telepharmacy, you can do virtual consultation. You can do remote patient monitoring using AI capabilities. Okay? And you can even clone yourself. So you can attend to several pharmacy patients, even though you are only you and you are not the one actually dealing with them directly. I always talked about it, that as I am now, it's possible that me that is doing this presentation is not me. It could be my AI clone. And it will do the presentation as much as I would do it as Gabriel, and you will think I'm the one that is speaking to you. It will speak in my voice, it will do my mannerism, it will do my gestures, everything, and you still think that I'm the one behind the camera. Meanwhile, I may be somewhere holding a meeting, I may be somewhere, maybe sleeping, maybe doing some other work using another system. So you see how AI can help you. So with telepharmacy, you can use AI to attend to a lot of people. Okay? Then how about patient education? You can develop AI-powered tools that provide clear and personalized educational content. What we are able to do in the AI-powered pharmacist bootcamp is we're able to teach pharmacists how to create patient education in different formats. How to create using audio, how to create using video, how to create using text, using even images. Now they can create posters. All those posters, they pay people to design for them. Now they can design it by themselves. They don't need to pay graphic designers anymore. All they need to do, if they want it in paper form, design it by themselves, take it to printer and get it printed. That saves them a lot of cost and time. And they are going to impute exactly what they want into it and create it. And this they can do in less than 10 minutes. So they are not even going to travel to somebody's shop to go and get that done or do forth and back. So this money is saved. Okay? You can input your logo. You can create several different things. Just this evening, I shared a prompt and a tool with them that now they can create any nature, any kind of image. So you want to showcase somebody that is sickly, you can create it. You want to showcase somebody that's well, you can create it using AI. In After you can put the picture of individuals that you know and create something, and it will make a lot of difference. That is AI now helping you create content for patient education that ordinarily you may not have the capacity to create. Okay? Now, so what benefits come to you as a pharmacist when you are using AI in your practice? First, time saving. Like I said earlier, you can create patient education in 10 minutes. You can create videos that speak. I am working on a video. I'm going to share it in the general group adverts that I'm using to advertise AI-powered bootcamp. In any pattern I want it. The one I'm creating for AI Mastery Academy is a baby. I just created something with a baby, and the baby is talking using baby voice. I mean, how can you get 1-year-old to talk about? I want to create the one that you can use to talk about medicine, to talk about maybe drug interaction or drug abuse or anything, use education. So soon, World Pharmacist Day is coming. It says, think health, think pharmacist. I'm going to create something that we can push around everywhere to promote pharmacy practice. I can create a lot of those things using AI. I don't have the capacity to create those extra videos. I cannot edit videos. But guess what? With AI, I can do all these things. So if you're not using AI, you are lagging behind. The person using AI will get the attraction. So if I create that kind of educational material and I put the name of my pharmacy, no law says I cannot do education. I put my phone number or I put my website. People want to reach out to me and say, come, how can we get this from you? Or if I put that out, by virtue of even knowing how to create that video, I can also make extra income for myself, serving other pharmacists to create these educational videos. Okay, so it saves you time. So what will have taken you 2 hours, 3 hours, 5 hours to create, you get it done in 10 minutes and you rest, like patient education we're talking about. It saves you money also. It saves time, it saves you money. So you don't need to pay people to create it for you. You can just do it on your own. It's also improved accuracy. The result you get is much better. The result you get is much better. It enhances precision of recommendation, thereby reducing potential errors. You are human. There's a limit to what you can do as human. But with AI, your capacity is increased. And since you are able to give patients the right information, you're able to help them in a personalized care, what happens? They trust you the more. And if a patient trusts you, what does it do? It comes back to you again and again and again. Two things happen. The profession gets more prestige, you make more money because they're patronizing you. And you can charge higher. I keep talking about it. I say pharmacists can make a lot of money being personal pharmacists to patients. You have a lot of knowledge that you can use, but many of you want to stay on take 2-3 times a day. I say, what if you become that personal pharmacist? So you become this personal pharmacy and you go the extra mile, right? You go the extra mile and use AI to improve the result you are giving them. You see that thing I said about personalized pharmacy or personalized medicine, you can practice it right here in Nigeria. And what will give you an edge is AI. How about clinical focus? Instead of handling complex clinical challenges, it can break it down and you can leverage your expertise to give the best to your patient. There are conditions that are very complex. You were thinking about it. How do I go about it? You can ask AI, for example, ordinary. Let me put the word ordinary ChatGPT, because many of you think that ChatGPT is ordinary because you're familiar with it. But you don't know that tool is a very powerful tool that can make a lot of changes in the way you do things. You can just tell it to give you different approaches. By the way, ChatGPT wrote exam with medical doctors and beat them. ChatGPT wrote exam with medical doctors and beat most of them. So you see, it's not just an ordinary tool. There's a portion. I tried to look for that document. I couldn't find it, where AI has been found to give result in regular cases, in complex cases. The only time that it needs extra information to give you result is in more complex cases. So when you're able to give the rightful information, you get the best out of AI, especially ChatGPT. This study I'm talking about is not what somebody did randomly. It's American Pharmacists Association that did that. Okay? Then AI opens new pathway for you. It opens new doors to exciting careers in digital health and data-driven pharmacy. So you are not just the ordinary pharmacist that people think all you did in school was to read doctor's handwriting or to tell people to take 2 tablets 3 times a day. Now you are going to be the noble profession that you are. People will respect you because of the value, the output, the performance, the efficiency, your productivity, all those good things that you are bringing to your patient and changing their lives. So if you're not using AI, you are shooting yourself in the foot. In actual fact, you are losing out. That's the truth. You're losing out. And there are opportunities for you to make a difference. So, how do you use AI? I usually like to go to practical for some of the things I've talked about. So let me just, okay, this real life application, I cannot do chatbots now because that will be a more complex situation. But let's see if we can do drug information, we can do patient education, we can even do telepharmacy. And I mentioned about creating a new career for yourself. So let's go off. Let's go to our, so I open this. Oh, not this, sorry. This, sorry. We'll do drug information. All right. So here we are on ChatGPT, right? And so let's talk about drug interaction. So I can say, I have a patient with this prescription. Sorry, I didn't prepare it. I do my things live so that with this prescription, okay? So metformin, ascorbic acid. I'm just bringing random things, okay? Glycoside. That's the spelling. Sorry. Glycoside, okay? Digoxin. Digoxin. And let me do for one that then. And diclofenac. Okay. All for 30 days. I'm intentionally writing this. Okay. All for 30 days. Right? Okay. This patient is a known smoker. Okay. And quite obese. No, obese. Okay. Tell me if there are any issues with the drug combination in terms of, I'm just trying to, it's something that you should know as a pharmacist, okay, especially for those of who are in full clinical practice, not like those of us who are in the Association of Non-Clinical Pharmacists. How many of you will join my association? Okay, so combination in terms of interaction, contraindication, and adverse events. I'm living like this, okay? All right, so I'm asking you to tell me if there are any issues. So I'm giving in a situation and I want you to advise me, okay? So see what he started with. So let's unpack carefully. You got a patient who is obese, a smoker, and on multiple drugs. Polypharmacy plus comorbidities makes interaction and contraindication a real concern. So let's look at metformin plus glycoside. Purpose, both are anti-diabetics, while metformin is an insulin sensitizer, glycoside is a sulfonylurea that stimulates insulin release. Issue, There's a risk of hypoglycemia, especially with glycoside, though metformin itself rarely causes hypoglycemia. Now, I did not put the doses, okay? It was intentional, but I'm just trying to make you see how AI can help you. Obesity. Metformin is beneficial in obesity, weight neutral, or weight loss. While sulfonylurea like glycoside may worsen weight gain. So you see, good. Then diclofenac and digoxin interaction. NSAIDs can reduce renal perfusion, decreasing excretion of digoxin, which will lead to what? Digoxin toxicity, such as arrhythmias, nausea, and visual disturbances. Smoking and obesity. Now, in this case, it's a condition because that's part of the person. It says what? Cardiovascular risk is already high. Diclofenac further increases the CV risk, e.g., stroke and myocardial infarction. Added problem, NSAID can blunt antihypertensive drugs if the patient is also hypertensive, very likely given the fact that the patient is obese and also smokes. Diclofenac and metformin. Risk, NSAID reduce renal flow, therefore increase risk associated lactic acidosis in predisposed patients. For example, patients with renal impairment, hypoxia, and smokers with possible vascular disease are more at risk. So you see what he did. He gave a combination of all this, okay, and gave us a big picture. So this is the finality. This patient at risk, real risk of hypoglycemia, because diclofenac will potentiate the blood level of glycoside, and renal impairment acidosis may increase if you combine metformin and NSAID, and toxicity may also happen. Comorbidity, smoking, and we add cardiovascular risk, making diclofenac a very poor choice. Safer alternative, if pain or anti-inflammatory is needed, paracetamol or COX-2 selective NSAID, which you can use with caution, may be better. So do you see now? Because of all this that's giving you, is advising you, yes, the pain may be an issue, use paracetamol, which is safer. As a result of that, you are able to reduce the hypoglycemic risk, the lactic acidosis risk, as well as the disease toxicity that may occur. You understand? Hypoglycemia, glycoside, and these are all the things. Okay? So if I were reviewing this prescription, this is what we're looking for. Diclofenac is red flag here. So do you see? Diclofenac is red flag here. And if you see all the analysis he did, it was very clear. Okay? Right. Can you see? AI helping us with drug interaction. Okay? All right. So it has given us a situation. Okay? Now, the patient's disease condition requires lifestyle modification. Can you give me suggestions that I can share with this patient? By the way, let me clear something quickly. I'm not saying that AI should take over your own professional activity. I'm just saying it can assist you in some things. So it doesn't mean that you have to leave every decision to AI. Let me sound this caution. But we are not saying AI can improve the thing. So when you're at a fix, AI can quickly give you a result. Now, there are specific AI tools for pharmacy. I'm using ChatGPT because this is what is readily available to most of us. Okay? So don't say that I am trying to get you to replace yourself with AI. AI is supposed to be an assistant to you, to help you. So now I need to do patient education and see, this is what it tells me. So you need, remember, he's a smoker, we need to do smoking cessation. This one you don't need AI to tell you, but I'm just trying to let you know how AI can also come in this area. Okay, so encourage them to quit and seek nicotine replacement, counseling support group. Even reducing cigarette intake step by step is better than nothing. So even if the person will not quit, if he smokes like 5 sticks a day, you can get him to reduce it to 4, then to 3, to 2, to 1, and maybe eventually 1 in 2 days, 1 in 5 days, 1 in 1 week, and 1 in 1 month, then 1, not even 1 at all. Okay? See weight management. 5 to 10% loss in the next 6 months can improve blood sugar, heart health, and joint pain. Step, reduce portion sizes. These are steps you need to take. How about dietary adjustment? Okay, how about dietary adjustment? You can help advise. How about physical activities? How about alcohol? How about medication adherence and monitoring, or MTM? How about sleep and stress, regular checkup, and all those things? All right. So you see how it's helping us with this. Okay, and you can create this into PDF, or you can even create it into a flyer. Okay, so I can say, can you describe a flyer that can be helpful to this patient? Okay, and let's see what it's going to give us. Okay, you see, take charge of your health today. Small steps, big result for diabetes, heart health, and weight management. So you see, it has created something like this. And I can tell ChatGPT to go ahead and create this flyer and to create it for me. We don't have the luxury of the time to get that done. Okay? So you see how AI can help us in creating this we wanted. Okay? I can say, make it minimalist and with few texts. Okay, let's see what it's going to give us. So I'm just going to pick this one just as it is. Okay, I'll just pick it as it is. I'm not expecting anything great because the text is still too plenty. The text is still too plenty. So I'll Control C. I'll come to ideogram. Do I still have? Okay, I still have some credit here. So let me close this one. I'll come here and I'll paste it here. And I'll change. Okay, leave it at the 2x3. Or do I do? Let me do a longer one. Let's see, 9x6. This is too long. So let me do 2x3. Okay. Then I will say generate. I did not give any information. I just say generate. So we can now create this. Now, I taught in the AI pharmacist bootcamp, I taught how to create this better than what we can use this and that tool that I told them to. So you see, small steps, big change. Quit smoking, take your meds, eat fresh, low sugar, move daily, and so on. See this one. See this also. Regular checkup, cautionary, and everything. See this one also. Quit smoking, take your med, eat fresh, move daily. Health is in your hands. You see all those things, big steps, small changes. Okay? You can even use, what's it called, Canva to achieve the same goal. Okay? So go to canva.com. I think my Canva here has AI. Is it the one that has AI? Let me see. Is this the account that has AI? I'm not sure. Let me try. The one of my account that has AI. Okay. So I want you to create, I want to design for me. And what do I want you to design? Marketing. Let me say marketing. What's the format? How do I want it? Flyer. Okay, let me make it infographic. Yeah, let me make it infographic. Then I say, go ahead and create for me. So Canva will go ahead and create for me using this AI capability. Okay, so let's see what it's creating for us. So it's still gathering ideas and coming up with an infographic that I can use for this patient. So you see how AI will go ahead to help us in our journey to health education. Okay, so it's finalizing the design for us. Okay, so see, it has given us, this is an infographic which you can modify. See this, the good thing about what's it called, Canva, is you can edit all these things right here without an issue. See, added picture, you say it gave something, right? See this one. So this one, I prefer this one because of the image, or this, both of them look good. This, which one should we go with? You see, quit smoking. Okay, so I can go ahead and edit this one by one and make it good enough. So you see how AI is helping us. Okay, so these are the ways AI can help. Let me just do one more thing. Okay, so help me with this concept. A new concept. I will share my idea with you. Do you understand? Okay. So I want to start afresh. I'm trying to get it to, okay, I prefer this response, doesn't matter. So I can now say, I want to start telepharmacy as an area of my practice. I need you to give me advice whether it is a timely and profitable venture in Nigeria. Okay, let's see. So it's going to give me advice whether what I want to do, whether it's good or not good. Okay, you see, it's now doing analysis for me. It's telling me about the growth potential in telepharmacy is sky high. The market projection is 12.3 billion, 12.23 billion, going to 14.27 in 2025, and has given us the source. In Nigeria, online pharmacy alone generated 61.38 million in 2022. That's a lot of money. Hey, pharmacists, how much of this market did you take? Let me tell you the truth, right? Most of this did not go to pharmacists. Forget the fact that the money is this large. Most of this did not go to pharmacists. They went to maybe networkers, and most of them are not pharmacists. Of course, they sell online, but pharmacists, you are there trying to hide behind your cubicle. Okay? I hope you guys are learning. Okay? So, and it has a compound annual growth rate of 29%. That is quite high. See the demand. For example, in Anambra State, a study found that 70% of patients consider telepharmacy very acceptable. This is a study that was done, and it was published on PubMed, Telepharmacy Services in a Developing Country, Nigerian Community Pharmacists and Patients. So do you see? 61% are willing to pay around $2.76 per month for these services. How much is that? That is about 5,000 naira per month or more. So let me say about 5,000 naira. They are ready to pay about 5,000 naira for telepharmacy. This is not inclusive of drug, just offering the service. So if people are on subscription, 5,000 naira every month, how much can you do? Imagine that you even go beyond that and you go to the airlines and say, no, I want to target those who are in the top level and they are charging 50,000 to give them that personalized care. You have, let's say, 10 of them. Is that not enough for you to just practice that alone? Okay? So there's ready demand and willingness for payment, benefit for the pharmacies and for community. What are the challenges that are likely to face? You see, that's highlighted is that. What are the recommendations? You see the recommendation they have given. It says subscription-based medication counseling or virtual refill services. Even at modest per use pricing, scale can multiply. Digital payment also. You tackle barriers on head on, build trust and awareness. Final verdict, telepharmacy in Nigeria is timely and potentially profitable. The demand and growth trajectory is strong. Then from here, you can take to the next level and you build the business using AI. In the AI powered pharmacist bootcamp, we'll talk about how to translate your idea into a business. We showed the step by step, even getting your first sales, okay, making your first money using this. You see how different this is, how this is changing things for us, okay? So let's go back to our presentation and see how we can get it. Okay, so I've talked about new career, we'll talk about education, we'll talk about drug information. So you see how AI can help you, right? So what is the future? The future is predictive, preventive, precise. The future is predictive, is preventive, and is precision healthcare. Predictive, being able to be proactive, being able to envisage what is likely to happen and nib it in the bud. Prevention is that act of ensuring that what may likely happen does not happen. And precision is targeting patients as individuals rather than targeting them as a crowd. Okay, a time will come that you can create a medicine directly for a person in the way it will help that person. That is the time. The time is coming. The time is coming. You know, we have 3D printers that create something. A 3D printer can create a shirt for you that fits you only. We'll get to that time someday, and that is AI at work. Okay, so AI plus pharmacists equals to better outcomes, not replacement. AI plus pharmacists is equal to better outcome and no replacement. So the future sees AI as a powerful co-pilot, augmenting human expertise rather than replacing it. We anticipate significant expansion into telehealth. And this is what I'm teaching. I'm talking about personal branding for pharmacists, which I taught in the AI-powered pharmacist bootcamp. You can take it beyond personal branding to becoming a telehealth expert or a telepharmacist. And it starts from building that brand for yourself. Building that brand for yourself. So you can now offer telepharmacy as a service of your personal brand that you may have built online. So there's going to be a significant increase in that place, integrated community services. So you can run a community service and also bring these things into your practice and increase income for yourself. Many community pharmacies are not differentiated. Everyone is the same. The only way you can see difference is they are either some are well stocked or they have beautiful entrance or they are located in some key places. But there's no differentiation. There's no difference between coming to this pharmacy and coming to the other pharmacy, going to the other pharmacy. Every almost the same. But you can create a replacement, a difference for yourself, a uniqueness, a differentiation for yourself so that you can serve a particular people. I've always talked about specialty pharmacists. If you think about it, it will help you. You can even start a pharmacy without owning a shop. Telepharmacy is one of it. Okay. All right. So what are the roadmaps? How can you now embrace AI in your pharmacy practice? How can you embrace AI in your pharmacy practice? The first one is awareness. Understand AI's capability and its potential impact on your practice. And that's what we are doing. That's what health tech innovation is doing for you. We are giving you that enlightenment, the awareness of AI. We want you to know that this thing is there and it can help you. The next thing is adoption. Now that we have told you and you know, what are you doing about it? What are you doing about it? So you need to bring it in small steps, daily tasks, all the things you use. Just like Fatai said earlier, is using neem in his patient therapy, drug therapy. Okay? So how are you using it? You need to start gradually. And in the AI Mastery Academy, we help you do this more easily. Okay? Then you apply it. Apply AI insight directly to patient care scenarios, improving the outcome that your patient gets. Then, as you are becoming aware, you're learning more, and you are gradually adopting it into your practice and apply it in different areas, you build authority and position yourself as that AI savvy leader within the healthcare community, where people see you as an authority and come to you and people rally around you. The reason you guys are listening to me is because I'm a pharmacist that is good with this thing. And because I've adopted and I'm applying it to the things I do, even if not directly in pharmacy. Of course, I did, because I wrote books that are related to pharmacy using AI. Okay? So this phased approach will ensure a smooth transition into an AI-enhanced practice, empowering you to deliver superior patient care. And I will not get tired of telling you guys that you have what it takes to differentiate yourself in the market. You have what it takes to be that leader in the market. So I'm inviting you to AI-powered pharmacist bootcamp. The AI powered pharmacist bootcamp starts on September 8th, which is the next Monday. It's just 17,500 naira, and you are going to learn things that will make a difference in your practice. And if we are starting with book writing, and even that first week, you are going to make your money back. You are going to become an author. You are going to see how you can use AI in different areas of pharmacy, and you can make a difference for yourself and for your practice. I don't know why many people are sitting on the fence, especially pharmacists. That is so absurd. People that are not pharmacists are doing great work in your field, but you that has that authority, you're not using it. I wish and I pray you change. I hope that you will take this step. So you have my email, you have my phone number, you are in the group, reach out to me, join the AI powered pharmacist bootcamp to bring change to your practice. Don't be left behind. Don't wait until everybody has done it and then you come to struggle with those who are moving. People that will adopt it now are those that will gain the most of it. By the time several other people get into it, the water will get murky and muddy. And guess what? There's less for you to enjoy. Now that the space is wide open, the wall is for you, for your taking. Will you ignore it or will you take action on it? So that's all I have for you tonight. I believe that this has been quite helpful to you, and you have learned one or two things as it relates to using AI in pharmacy. I don't know if you have any question. You can ask your question. If you don't have any question, maybe we can call it tonight, because quite well, we have done 1 hour plus, and I think this is a proper time to end the show. Let me see if I can improve the lighting, although we are about closing anyway. Okay. Oh, wow. Okay. All right. From Akin said, you are bringing out great nuggets here. Yes, that's why I'm doing this. That's why I'm doing this. I want pharmacists to see this opportunity and not miss out on it. I want you to take advantage of what is readily available to you now before it gets unavailable, or before the crowd takes over and you cannot get what you want. So I want to believe that this presentation was clear enough, was rich enough, and showed us what is possible. Right? Okay. So thank you very much for joining us in today's show. I want to believe that you have gained quite a lot. We can call it a night. Let's go and rest. The replay will be available for you. You can watch it again and again and pick up 1 or 2 nuggets that you can help. But for those of you who are not in the AI-powered pharmacist bootcamp, I'm calling on you to join us. We don't know what will happen in October, whether the price will increase. But for now, it's still 17,500 for 30 days and 1 year mentoring. Okay? Looking forward to working with you in the bootcamp. Thank you very much. Cheers. Enjoy your rest.